Namaskar everyone, all senior and junior alumni who have joined here today on Zoom and other faculty members, students, as well as our well-wishers of our institute, as well as Medical Humanities division who have joined. It is immense pleasure and honor to me to welcome you all in this program of release of Reflections 2023. And every year we come up with actually Reflections is annual publication of Medical Humanities, and every year on different themes we bring out this volume of reflections. In 2019 the theme of the book was History of Medicine. Then in 2020 it was interpersonal relationships in medicine. Then COVID came up, so COVID-19, the human angle. And then 2022 volume was about literature and medicine. So different themes. And then as we approached our centenary year, nice virtual reunions were planned in which all of you participated, different batches. And based on that, we came up with this volume of 2023, that is GSMC Reminiscences Part 1. It will be released. Actually, our Dean Madam, Dr. Sangeeta Rawat, she is busy. She is caught up in some meeting. So I will just confirm with her and then we can further proceed. If you can allow me 2 minutes, I will just do that. Thank you. Yeah, Madam has said that she will just join for a minute because she is in a meeting, an important meeting. Madam.
Very sorry, I had to come for an urgent meeting at CPD. So can
Yeah,
we
Madam.
have the book ready? Yeah.
Yeah. Thank you, Madam. Thank you for joining in spite of your busy schedule and in spite of being in CPD. And thank you all for all your support for all our activities of Medical Humanities Division. And I request you to announce the release of the book Reflections 2023, which is about GSMC reminiscences, which were discussed in the virtual reunions, which were conducted in association with Gosumec Alumni Association. And they were penned down by the authors or the our alumni of different batches. And you can say a few words, Madam, and announce the release of the book.
Yeah, I think Medical Humanities is also getting an award now. I just received the thing that they are getting an award also from the National Human thing, and that's a very really prestigious thing that we are getting this award. And 27th, I think the function. So I would request all of you to join for that also. It's really the Swarupa and all do really hard work, and it gives a great satisfaction when we read these such books. And I declare that this book is open now, and I thank the whole team who has worked for it. And congratulations once again, Swarupa.
Thank you, Madam. Thank you once again. Thank you for releasing the book.
Yeah. Okay.
Now we will see one PowerPoint presentation.
Can
Yes.
Okay.
Now we will talk about.
Thank you. I'll leave Swarupa.
Yes.
Okay.
Yeah. Thank you, Madam, for being here. So this is about the contents of the book actually. in 2023. This is about GSMC Reminiscences Part 1, which was little delayed because of certain unforeseen circumstances, but we are delighted to release it in our centenary year, and I'm sure we will come up with remaining virtual reunions and with remaining reminiscences which were discussed in the other rest of the virtual reunions in our Part 2. That also we hope to bring about in before our next year centenary in 2026. So now this is the cover page of the book actually, of showing our college and hospital. Myself, I'm editor. Dr. Avinash Supe is chairperson, and we dearly miss Sunil Pandya sir, who was our former chairperson. Of course, Lopa madam and Ravi Ramakantan sir, they're always there as our pillars of support. And Dr. Padmaja Samant, she is our medical humanities coordinator. And of course, other members of medical humanities chair and division are there. Their support is always there. Now, this was my editorial. I'm from 1990 batch, alumnus, and currently I'm working as associate professor in the Department of Transfusion Medicine. So, who are we GSITs is my editorial, and this is a short verse which I have mentioned in my editorial. Now, actually, we arranged these particular articles as per the dates of virtual reunions in that sequence. So, chronology may be a little different. It is not exactly chronological, but as per the dates of virtual reunion. So, these are the contributors from 1960, Dr. Nadkarni Madam and Sunil Modi sir. And from 64 batch, Dr. Kalin Bakshi was the coordinator, and he could connect to many of his batchmates, and many of them have written. So this is in alphabetical order. I've arranged these authors from 1964 batch, these two. And they have also mentioned and highlighted the achievements of 1964 batch at the end of their article. 1973 occupational therapy. Dr. Falgunisha madam, she also was very enthusiastic, and she immediately submitted her article about GSMC reminiscences. From 1994, Dr. Swapna Dharashivkar, who is in the US currently. 1992 batch, Dr. Abhijit Pednekar and Manjusha Naik Kulkarni. She has submitted article in Marathi titled Shidori, because Shidori, as we know, it is our beginning at the when we get admitted to GSMC as our first year students. Shidori program is there, so her article is titled as Shidori, and she has submitted it in Marathi. And from 1986 batch, these are the contributors. From 67 batch, Dr. Lakshmi Vasudevan madam is the coordinator, and she also could connect to many of her batchmates, and many have contributed. It has come out as wonderful article, and she has been very perfectionist right from the beginning, that the corrections and her persistence and perseverance, and finally the product, she saw to it and ensured that final article is extremely good and perfect. And they also have fondly remembered the batchmates who are no more with us, so their memories also they have shared in their article. So these are authors from 1967 batch. Two 2005 batch, which are the junior most in this particular, youngest batch in this particular issue of reflections. So Dr. Sarika Dakre, who is also currently an assistant professor in the Department of Anatomy, Dr. Vivek Shah, and in 63 batch, Dr. Hamida Haji, madam, also very meticulous, and the final draft which she submitted on behalf of all the authors who have contributed, it was wonderful. There were no corrections required, and everything was so perfect that I just copied and pasted it in the book. There were hardly no corrections actually. It was all perfect. And 1990, my batch actually, my undergraduate batch, my friends Vijaya, Pankaj, and Deepa, they have submitted their articles. And these are some of the photographs, 1963 batch, their picnics, internship, reunions. So they're still very well connected. That's what Hamida madam told me, that the connection is very good still. They meet, and they are always in touch with each other. So that is one nice thing about being GSites, and our batchmates are always there lifelong with us. 1967 batch, sports, picnic and reunion. This was submitted by Falguni Shah Madam, 1973, occupational therapy, some drama, sports. She herself is a sport enthusiast. She will talk more about it in her speech. This is 1986 batch, the Silver Jubilee reunion in 2011. And this is from 2005 batch, the picnic, sports and graduation. So there is transition from black and white photographs to colored ones now. So thank you for all your contributions and making this volume of reflections a success, grand success. So now we will talk about the contributors will now contribute. Now, actually, Dr. Swapna Dharashivkar Dev, she had joined from US and her time is at it is 2:30 a.m. But still she had joined. So I really appreciate her. It is all because of love for GS. I'm sure about it. So Swapna, you can say a few words. Because your
Hello.
timing is very.
Hello, just a minute,
How are you,
Swarupa.
Swapna?
Good, doing good. Thank you. Sorry, I think, go ahead. Somebody else wanted to speak.
Eleni madam wanted to say something.
No, hello, I am Dr. Nadkarni. Dr. Vandana Merchant just now called. She cannot join. So
Okay.
I'm not able to fix that problem. So can you do something for that? Dr. Vandana Valvekar. Vandana Merchant from my batch.
Yeah,
1960
she is
batch.
not able to join on the Zoom link, madam.
Yeah.
Okay, I will share the link once again with her and I can
Okay.
talk to her.
Okay.
In the meanwhile, Swapna can continue.
Yeah, sure.
Thank you so much, Dr. Swarupa Bhagwat. I really appreciate it. Hello, respected Madam Dean. Thank you. Respected Lopa Madam, it's so nice to see you here on the Zoom meeting. All my teachers, fellow GS site alumni, and everyone present here. Thank you for Thank you for the opportunity to speak today, sharing, reminiscing about my time and experiences at GS. I'm Swapna Dharashivkar Dev from the 1994 batch of GS Medical College. I'm currently a practicing endocrinologist in Louisville, Kentucky, USA. A teaching institution is considered successful when majority of its students feel that they have benefited from it. On behalf of my fellow batchmates, I can confidently say that that is true. My joining GS was a product of my willfully wanting to make it happen, along with what I call as a divine intervention. Although I knew from a very young age that I always wanted to be a doctor, I had no inkling of the medical college I was destined to be in. When I was in Nagpur, finishing up my 12th standard, I had made up my mind. I wanted to be in the best college in Maharashtra, which I knew was in Mumbai. A casual call with one of my good friends who had relocated from Mumbai to Nagpur educated me with the name of this college as KEM. It then took me several weeks later to realize that GS and KEM were the same. When the ranking list was put up, a relative in Mumbai was nice enough to check it out in the incessant monsoon rains. We noticed there was some discrepancy in the list, and another distant cousin who had hardly ever met went all the way from Dombivli to get it corrected. A huge task indeed by these helpful souls. That correction made me eligible to enroll in GS from the All Maharashtra list. I still have very vivid memories of sitting in the huge admission hall where I made some of my best lifetime friends, getting called out one by one and going down to the room where all the deans of the MMC colleges were sitting in one place, asking the students their choice, their college choice. Without a moment's hesitation, I picked GS. I had finally gotten what I'd wanted. I was happy, ecstatic, but only briefly. Somehow, all of a sudden, the feeling of loneliness set in. There wasn't anyone from Nagpur to give up the comforts of a home medical college admission and come to a faraway place like Mumbai out of choice. I had no one I knew that I could ask guidance for, travel with on the long train to Nagpur, or get hostel experience tips from. I doubted my decision to come so far away from home. Realizing that I was in a quandary, Dr. Lopa Mehta warmly invited me to have a chat in her office. Her encouraging talk for 30 minutes allayed my fears and gave me enough courage to stick with my decision. I think it was a divine intervention indeed. Thank you so much, Lopa Madam. The first few weeks of GS were difficult, with persistent rains, cloudy atmosphere, and homesickness. I missed my family, home, city. The beautiful halls and the prestigious reputation of GS, which had beckoned a 17-year-old, still held their charm. But it took a few months before the rains and the cloudiness and my mind finally cleared up. I finally started to settle in. Thankfully, GS was all that was promised and much, much more. I found like minded people, driven people all around me. I found wonderful friends. The teachers had tons of knowledge to give, and our eager, absorbent sponge brains tried to soak it all up. There was so much to learn from everyone and everything around you: your peers, teachers, seniors, cadavers, labs, books, patients, you name it all. All of these helped me lay my early, strong foundation in medicine. For a newbie like me with no doctors in the family, this was very essential. As every year progressed, I found myself enjoying the medical and extracurricular opportunities I received. The city of Mumbai grew on me, like it does for everyone who steps on their foot on the soil, and I was a part of the vibrant atmosphere that forever changed me for the better. I'm privileged to say that I have been a tiny part of GS, and GS has been a big part of me. My foundation of being a good clinician was laid and solidified within the walls of GS. When I left the country to see the world outside, it was this foundation, this knowledge, this clinical acumen that I had gained that gave me the confidence to face the world. I will forever be thankful to all the teachers, patients, colleagues, friends, and the actual building or the Vastu of GS for giving me so much. It has made me the physician I'm today. It has given me lifelong friends, memories, and values that I cherish. Our class of 1994 is now an active WhatsApp group. From being strangers in 1994 from different parts of the country to being like minded professionals now, the group finds itself sharing life's joys and sorrows, rejoicing in our colleagues and children's achievements, discussing world issues, and of course, wishing the happy birthdays. It is a support system fostered by the one connection. We are GSites. I could talk so much more, but I know I have just 5 minutes of time. As I wrap up my allotted time, all I can say is I'm grateful to be a part of this prestigious institution which has given me, and so many of us, so much. On the occasion of this centennial celebration, I pray that GS continues to prosper, and may we, as its products, move forward with a commitment to help humanity at large and stay humble and rooted to the ground. Wishing GSMC many, many more years of progress, innovation, and success always. Thank you so much all for your kind attention. Thank you again, everybody, for giving me this opportunity. I really appreciate it. Thanks.
Thank you very much, Swapna, for those kind words and very nicely expressing your thoughts, your memories about GS. And we really went down memory lane, actually, all of us, I'm sure. So now I request Dr. Sultan Pradhan, who is an oncosurgeon. He's from 1964 batch, and actually, as I understand, majority of 1964 alumni are in the US. And Dr. Kalin Bakshi is coordinator of 1964 batch, and he tried to contact many of his batchmates, even in India and outside, but nobody was able to join. And finally, I contacted Dr. Sultan Pradhan sir yesterday itself, and at such a short notice, I'm very grateful to him that he assured that he will join, and he has joined today in spite of his busy schedule. So I request sir to express his thoughts.
My pleasure, Swarupa.
Thank you.
So my name is Sultan Pradhan. I belong to the 1964 batch of Gosumec. I'm an actively practicing surgical oncologist. Actually, I joined the batch in 1965 in the second MBBS after completing the first MBBS at the Sholapur Medical College. I was accepted so well by the classmates. Everyone always helpful. Never a supercilious or condescending attitude, but they were all, after all, bright students who had the highest scores in their pre-medicals, whereas I had to take admission to a little-known capitation-free college and now getting admission to the country's best medical college. This culture and environment of friendship and camaraderie should be a matter of pride for the GS Medical College, particularly when you see what is happening in many parts of India where there is ragging for students, new coming students. Even after 60 years, I am still grateful to my colleagues, to my classmates, for that kind of warm welcome to a new entrant. And such wonderful teachers we had, such wonderful teachers. Dr. Parulkar, Dr. Bhalerao, Dr. Homi Dastur, Dr. Ravi Bapat, Dr. Dholakia, Dr. Arthur Disa, Adiyar, Devdar, J.K. Mehta, J.M. Mehta, Motor Shah, Narvekar, Purandares, Baruchas, so many, many, many big names with such commitment to caring and such commitment to teaching, such reverence to their work. We still remember their clinics. And finally, such beautiful facilities at the GS Medical College in those days. Excellent, huge Nightingale wards with a clinic for taking a class for students in every patient at the far end of the ward. We were so very, very fortunate. The 1964 batch is full of gratitude as it reflects on its undergraduate days at the said GS Medical College. Thank you. Thank you, sir.
Thank you very much, sir. Thank you for joining here and expressing your thoughts and your memories and all those teachers in those days when we were probably very young that time when you joined, or we were just born when you
You were
joined
not
the
born.
GSMC. Yeah. So,
All our stories are once upon a time stories.
yeah, true, sir. Very true. Very nicely put. by
But
you.
with God's grace, we are still very active. Very active. Okay. Thank you. Thanks a lot.
Now we'll move on to 1963 batch. Dr. Hamida Haji Madam, who is their coordinator for 1963 batch. So I request Madam to express her thoughts.
Amita, you have to unmute.
Yeah, I did it. Is that okay? First and foremost, I want to thank the Dean and all the organizers for giving me this opportunity of speaking today. I am Dr. Hamida Haji, and better known in college days as Hamida Karim. And I belong to the 1963 batch, and presently I live in London, and I'm a retired obstetrician and gynecologist. Um, what I wanted to just highlight is that KEM and GS Medical College was actually designated, as someone said earlier, as the best medical college. And I was so happy to be a part of this college right in the beginning. My whole career went so smoothly in the college. And what I learned and what I took the essence from the medical college was essentially knowledge. But the teachers installed such honesty, sincerity in all of us, which really took us right to the roots of our profession. And we were taught lots of to be honest, sincere, and regular in the treatment of our patients. We actually had a lot of sessions in which we were taught history taking, how important it was to do history taking and a clinical examination. And these were the things that we learned so thoroughly. And having reached a clinical diagnosis, we had very few investigations at our disposal to actually just confirm our diagnosis. The sophisticated investigations that we have today were not there for us, and even simple things like ultrasound. This takes me to a very short incident, if I may quote it to you today, is that when I came to London and in 1985, I appeared for the MRCOG exam, and the senior examiner at the Viva examination, she had a book, a book of cases that we had to write and submit before the Viva examination. And this book was right in front of her with lots of underlining in red and lots of stuff written in all the margins. And I was really very apprehensive when, uh, when I was standing there before her. She made me comfortable and asked me to sit. And she said to me that your book has really fascinated me. The way you have managed your own patients with all the judgment done on a clinical examination and very few investigations to support it. I was thrilled to read it. And I must say, she said to me, that we in the West will have a disuse atrophy of our hands because we depend a lot on lab and investigations for the diagnosis. I was so happy. I couldn't thank my institution more than anything. I thank many of my teachers, and there's a long list of them, but a few of them have always had an imprint all through my life. Dr. Manu Kothari, Dr. Bhattacharya, Dr. Ramchandani, Dr. Vasant Sheth, Dr. J.K. Mehta, Dr. V.N. Purandre, Dr. Motasha, Dr. Shirish, and I have lots of registrars to thank because they really took classes out of working hours. And I have many to thank. Is Dr. Ravi Bapat, Dr. Mahendra Sheikh, Dr. Ashwin Mehta, Dr. Asher, Lakshmi Asher, Dr. Rama Vaidya, and the list can go on. What I feel is the college was also a big fun place. Not, of course, we were very sincere with our books and studied and made good use of the library. I, for one, never had any textbooks and only read in the library and made notes. So it has lovely memories. We don't forget the memories of the corridors, the cafeteria, the canteen, the RMO mess. And there was so much friendship and camaraderie that we continue to hold in our class. And we have a WhatsApp um, uh, where we wish everybody on their birthdays, on their wedding anniversaries, and we never forget each other. They're always with us. And I also have to thank GS Medical College on a very light tone for having met my dear classmate, my very good friend, and my future husband, late Khalid Haji. Thank you very much, Swarupa, for giving us this opportunity and for the kind words you have said. Thank you all.
Thank you very much for joining, madam, and all the hard work that you have put in for the article. We really learned a lot from you, actually, during the process.
Thank
All
you.
the contributors, actually.
Thank you so much. And I thank all my colleagues who have joined us just to listen to us.
Thank you. Now I request Dr. Kanu Tejura from the same batch of 1963. I think he also had joined from the US. I understand. So, Dr. Kanu.
Kanu Tejura. Kanu, where are you?
Hello. Hello.
Hi, Vandana.
I am okay. Can you hear
Hello.
me now? Hi. Can you hear me? Do you? One second.
Yes.
We can hear you.
You can hear properly?
Yes, we can hear very well.
Okay, fine. Thank you very much. And
Dr. Swarupa. Dr.
okay,
Swarupa.
Yes,
yeah, I'm
madam.
starting.
Yeah.
I joined, so call me as and when.
Yeah, madam. With your batch, 1960 batch, I will call you. It is little later.
Okay.
Is that okay? Maybe
I
it will.
suppose if you can call me, I have a couple of things to do to the hospital. If you can manage it after Dr. Kanuja, it will be nice.
Okay, okay. I
If
will do
somebody
that.
wants to speak, it's fine with me. If
No,
somebody wants to.
no. Kindly go ahead. Please finish after I can wait till you come.
Okay, fine. Thank you very much. And the way I think that we all are reflections of our life, which for each individual we come in contact with, and we reflect them in our life later on. So I would like to thank each and every person, right from my childhood up to now, whoever I have come in contact, and they have helped me to shape me at present level, and my journey still continues with the love and affection of the people I get from. And again, when coming back from Bombo to Kampala, finishing the school and going back to India, Jain College and Medical College, me and my brother decided one thing. Say, okay, whoever gets more mark will go to GS. Who gets less mark will go to JJ, our Grant Medical College. We said it's fine. So we both sat in exam, and surprisingly, we both got same mark, 420. And at that time, there was a movie Three Char Service going on. And so we both ended up in GS, and still we are together. So that's what the life is about. And I enjoyed my working in GS, and I learned a lot, and especially my interest in pediatrics grew when I came in contact with Dr. Bhagat, and I liked the way he taught, and I was very much influenced by his way of simplicity and understanding very well. And also, I had a very good company during college. I had a very good company during the college years, and my hostel experience with Dr. Dev, and in the college coming in contact with Dr. Talsania and Dr. Pankaj Mehta, Rodavia, and a lot of others, Dr. Agarwal, lot. I list will continue with each one, and I learn a lot from help. And also, I like to also thank all the peons who helped me, like Mitu, Ramchandra. They were helped a lot me during the exam, learning a lot of tips from them, and also the Lakshmi Prasad Laundry, who helped me a lot about the life. So I really appreciate the lessons I was learning beside the medical knowledge. And the time flies. Finally, I was not a bright student, so I had to spend a lot of time failing, passing. And finally, I finished my medicine and came back to Africa and started practicing in Mulago Hospital, where I learned a lot. Again, the practical things, how to treat and how to treat, and learn a lot of pediatric patients. And mortality rate was very high during that time. And so I was kept very busy. I did my 6-month internship at Mulago in pediatrics, and which I very grateful, and I under Professor Milati, who was a very good teacher, and Dr. Bibo from Kenyatta Hospital, who was also teaching me, and I learned a lot there. And then finally, when the political things were not suitable, we had to leave the country, went to England. There I came under a contact with Dr. Professor Illingworth and Hutchison, and they were very, very excellent people. And they taught me a lot about the development and everything, and they were very punctual on the time. So it was a lot of experience I gained, and then finally ended up in USA because I could not practice myself. I know that I'll be in England at that time. I had to work whole life as a registrar. So decided to come to America and then did pediatrics here and settled down in Corona for last 50 years and enjoying the life. And it's a wonderful experience. And also I came in my classmate, Dr. Khalid, very much I wanted to thank him because he was the guy who joined everybody together. His first email, which I received in 2009, he said that we are just a spark of light, no matter very small. But he said, if you come sometime in your life, you may light up the star. So that pierced my heart, that we are a spark of light, and we are capable of brightening the star. And that was the positive message I learned from his first poem. When he just said, we said hi and we joined the group, and so he was always giving positive quotation, in which I inspire a lot, and sometimes in difficulty, then at the right moment, by coincidence, his mail come to me to encourage in the life process to go further and not to depress, because the life is a full of roller coaster. And then Hamida was her backbone, they helped, and what then they joined, then afterwards at the technology advance, they formed Facebook. So in that way, I learned about how to join Facebook and technology, because I was poor in those technology, and then now joining the WhatsApp. And after Khalid passed away, the Hamida took over, then Vijay Siralkar came, they all managed the group, and I'm really grateful. And then I come with the wonderful people from my class, like Dr. Lopa Mehta, who was in anatomy professor, and then this Dr. Aruna Bapat. I went to her house. First time I thought, but how she will feel, because it is like something like a 50 years going back to the how visiting somebody, but she welcomed, and I felt like a home and had a very good time. And then I came across a lot of people, and our class had a lot of bright people, and also like Vasant Sastrabudhe, who joined the army, really inspiring. Then Irene Moses' husband, George, she married to the George, again, who was the Indian Armed Forces. And looking back of the life of them, we feel that the life is just a flow, and the divine thing is just making us moving forward. And during pandemic also, the Lata Kadare wrote a very good book, Locking Down, Managing Her Anand Meva family, and right, giving hopes, and they came out of the COVID with the fullest positive energy, and how they fought the pandemic. It's a very interesting story to read, and also I enjoyed the book written by Irene Moses, because she experienced a lot of moving from different part of the India, helping others. And here then we had a very good students, and they are not in the medical, not working with the GS, but outside, like the Jugal Agarwal, then the Rasmikant Patel, and a lot of inspiration. And there are a lot, each one of our classmates, like Susila Rathod, the Pravina, they all have contributed in one way or other to the college, to the society, and each one of us has made the world better, I would say. And everybody has played their part positively in developing and curing the welfare of the health of whatever field they are. And I thank you. And it is just, we all are doing this. It is still something from the divine, you know. It is a law of karma. And like Dinesh wrote a very good book about Hinduism. It's fantastic. I really appreciate my class page, all the students, all everybody, and really I pray to you all to bless me, because your blessing is helping me to make my journey in this life better for the next life, whatever will be. We don't know, because we all are travelers in this world. And also Manu Kothari, when I, in the 50 years union, I had a great time sitting with Lopa Mehta and Manu Kothari, and we discussed the philosophy of life, and I was very much impressed with him, really, because in the holiday, I know he was very fast talkative about anatomy, which I don't understand, was very behind, but then he was a very simple person, and I really enjoyed it, and I'm very glad that his name still signing and the lecture is under his name. He deserves. We are very fortunate to have such a brilliant person with whom I come in contact with.
Yes, sir. We all remember, sir, Kothari, sir.
Okay.
And
And then finally, I
sorry
like
to
to
interrupt, but we thank you very much for joining today.
yeah, thank you
from
very
our
much.
batch, and
Sorry, I went beyond the time. Thank you very much. I wish
cherished all
you,
the
wish
memories.
you all. Yeah, I
very
stand
much.
up with one prayer. With I pray to Lord to direct all of us. Aso tama sadgamaya, tam soma jyoti gamaya, mrutyum amrita gamaya. Om Shanti, Shanti, Shanti.
Yes, sir.
Thank
Thank
you.
you. Thank you, sir. Yes.
Sorry, I went beyond the
Cherished,
time.
no, yeah, we in flow,
Oh,
sir, and we, when we
I
talk
didn't
about
know.
our friends and all
I
those
was
memories, they
supposed to
just
talk
come up,
for
and
3
it
minutes.
is fine, sir.
That's
No
okay.
problem.
Okay.
So, but sorry to interrupt, because other speakers have to speak. So, now I request Dr. Vandana Valvekar, madam, she's from 1960 batch, to.
वंदना अनम्यूट कर वंदना
Kela. Okay. Now am I audible? Am I audible?
yes yes
Yes.
Okay. It is a pleasure and a privilege to be able to do something and say something about our experiences in the GS Medical College. Uh, I was very lucky to have joined on a VIP basis. Why? Because not only marks, but I was that time the national champion of swimming. So then there was a lot of, even the dean that time, at the time of interview of admission, congratulated me. And I was really, I felt really very touching to have had that. First MBBS, again, it was a mystery to us because it didn't matter because we had not seen inside of a human being. And there, it was very important that Dr. Bhatnagar and Dr. Kalgudkar, Dr. K.D. Desai was the head of the department, and they were very patient with us. You know, they explained things and all that. Dr. Manu Kothari joined the department much later, but it was very important that if there is any problem, Dr. Manu Kothari would quietly, Shanti used to explain to us and talk to us. So that time, the first time we came across this brilliant man, Dr. Manu Kothari. As I progressed further, I during the posting, I fell in love. I fell in love with the I fell in love with the with whom none other than Dr. Allergy, and did all my residency and everything. He had a lot of academic discipline. You had to listen and you had to do things. So that gave you an incentive, professional incentive and academic discipline. And thanks to that, as I joined as a professional and associate professor and honorary at the hospital that I just come. At that time, what happened was that I had gone to Professor Nicolaides for a fellowship in ultrasound. And there I saw all the nurses were operating ultrasound. I said, here, why are we not doing it? Why gynecologists are not doing it? So I came back to the hospital.
Can't hear you, madam. Probably your network is
Gynecological training, I think, for the my ultrasound training. Today, the thing is recognized by not only Foxy, but by everyone. And we have trained as much as 2,500 SARC gynecologists. And today we know that gynecologists have their own ultrasound. Most of them have their own ultrasound and facility and understanding. One another important thing was, again, incentives. This was an academic discipline, what is happening in the world. And we had a lot of RH isoimmunization patients. So now with Dr. Chandar Lulla, we at the Vadia Hospital, we conducted the first ever intrauterine transfusion for RH isoimmunization in the country. And now it has become a routine, and now it has become this thing. So I am very proud that KEM has taught me, GS Medical has taught me this, and we have been able to share it with my colleagues. That was one. Secondly, I would like to say something about Dr. Manu Kothari. Dr. Manu Kothari is a brilliant man, and he was with us for a very short time, or rather, we were with him for a very short time. But whatever it was a very friendly, very quiet, and very enlightening experience to be with him. Anyway, so this is what these are some of the things that I miss, admire, and cherish about GS Medical College, KEM Hospital, and Vadia Maternity Hospital. As the professor for this thing, Vadia Maternity Hospital, and the dean of Vadia Hospital, we did that. We did a lot of training of ultrasound. We did a lot of training in fetal medicine, and that was because of the academic discipline that we taught that was taught to us. When it was a little diversity also, understanding the subject properly. Dr. Subhash Purandare told me that you are doing gynec, yes, but supposing you have some problems in surgery, other area, so you must do one surgical post. So I did one surgical post with Dr. Arthur Disa, and that was a wonder. He had a fantastic sense of humor, and I learned so much about it. So I felt very confident of handling situations which are even non-gynec surgically. So these are some of the things that I have learned and I'm grateful about. I hope I have been able to pass on something to our students and colleagues, and it has been a pleasure. So thank you very much, Sarupa, for this opportunity to be able to say my things about GS Medical College, Vadia Maternity Hospital, and most importantly, Dr. Manu Kothari. Thank you very much.
Yes, very nice, madam. Thank you. Thank you for joining.
Mm.
Yes.
Okay.
Thank
I'm leaving now. I got to go somewhere.
Okay. Okay. Thank you. Now, I request Dr. Snehalata Dhaigude, madam, who is from 1963 batch, to express her thoughts. Madam, unmute
Sorry,
kara.
I was, yeah, sorry. Anyway, एक minute. Good afternoon, good morning, and good evening to all the alumni around the world. Thank you for giving me this opportunity. एक minute. There was some sign in the front of. I'm extremely proud of my institution as I learned a lot from both GS Medical College as well as KEM hospitals. I endorse all the feelings of the previous speakers about the teachers and the colleagues, and definitely don't want to repeat the same thing. We certainly had legendary teachers, and that was the best foundation for us when we go out. So cultural values like discipline, hard work, perseverance, and ethics have helped me tremendously in my life, and it was a solid foundation. Although I did not complete my post-graduation from KEM, I followed my husband's surgeon, Dr. Dhaigade, and went to UK to complete FRCA in anesthesia. But after coming back, I worked in KEM anesthesia department for a year and then started private practice and work as honorary in Vadia Children's Hospital. But I had a long association with KEM anesthesia department as I got involved in academics. Over the last 20 years, Department of Pediatric Anesthesia in KEM is well established. And in fact, over 3 decades, pediatric anesthesia has seen humongous progress. Understanding of basic sciences, availability of new drugs, equipment, and monitoring gadgets have made pediatric anesthesia much more safer. I have witnessed this KEM pediatric anesthesia department. I'm talking about this because last 3 decades, I've been only doing pediatric anesthesia. And I think all other people are talking about their department, so excuse me. When we received an appeal for donation during the centenary year, I had a strong desire to help pediatric anesthesia department because they always lack some kind of equipment or gadgets. Although as a Rotarian, through our club, we had donated few gadgets. But as an alumni, I wish to donate individually so. So I was happy to donate bear hugger blow air warmer, which was needed by the department to keep the babies warm during the anesthesia for their safety. I appreciate Dean Dr. Sangeeta Rawat's great initiative to organize various events and releasing the book of memories of all alumni of KEM and GS Medical College. So at the end, I just want to say I have a special feeling for my institution for 3 reasons. First is, of course, I had undergraduation in GS Medical College, which is always ranked 1 in the country. Then Dr. R.G. Dhaigude was the 4th dean of our institution, and he was uncle of my husband. And another thing is Dr. Nandini Dave, who was a professor and head of the Department of Pediatric Anesthesia. So both of us compiled a book on pediatric anesthesia for postgraduate students. And it is the KEM Foundation which has helped me to sail through smoothly in all my life. And I must say thank you to everyone and best of luck to all the alumni and all the organizers and everyone. Thank you.
Thank you, madam, for joining and putting your thoughts so nicely. Yeah, now I request our very dear Dr. Lopa Mehta Madam, who is not only our advisor, she's also 1963 batch alumnus. So I request Madam to say a few words.
Hello, is it fine?
Yeah, we can hear, Madam.
Lopa, you have to unmute.
Yeah, again it has gone on mute. Please unmute.
I had the pleasure of witnessing on YouTube from July 1st, 23 to end of December 24, all the reunions. Having been a first MBBS professor, I could relate to almost all those students who participated. What I could see is that everybody was very proud to be a GSI. Secondly, they all were very happy in the very majestic buildings to be studied. They all had great reverence for their teachers. And then they all valued enormously their friends. They were their great support. They all vividly remember their hostel chaos, and they all enjoyed how they participated in various extracurricular activities. In all, everybody has expressed great joy to be a GSI. And I am so happy that these reunions have brought together all the GSIs as much as possible. I must thank Dr. Natarajan for establishing all the WhatsApp group and coordinating all those programs. We are already seeing part of it in a printed version today, and I am sure Swarupa will come out with part 2 in coming future. And I must thank all the people who have made this possible for working for humanity divisions. Dean onwards, Dr. Padmaja, Swarupa is the kingpin. Dr. Kanchan Kothari has constantly been there to help out these programs. And now the current secretary and all those 6-member team. And then I can't forget Tushar and Badal doing faithfully every Saturday evening, 6 o'clock this job. So I'm grateful, thankful to everybody for putting this program so successfully and culminating today in this publication of the issue, for which Swarupa deserves all the credit. And of course, I'm grateful to Humanity Division. And as far as my batch is concerned, it's a thriving batch. You have to see 63 WhatsApp group. That is what has happened. With this, all the batches have made their WhatsApp group, and now everybody remains in communication. So this Corona centenary, everything has brought all the GSIs together. I'm thankful to Almighty to bring us together. Thank you very much. Our batch was a very non-competitive, middle class. There were no VIP. There was no very rich person. Nothing. Everybody, most of them came from Charles. Then we all had a unison. Until today, we are having that. And you can see that Dr. Pravina, Dr. Rumi Jangir, all of them contributed a lot to the building up of various departments. Pravina in neurology, Rumi in ophthalmology. The others have contributed world over, all parts of the world. So everybody is very proud of the institution and the batch, and everybody is eternally grateful for allowing the institution to us to reach whatever we have been able to do. Thank you very much. Thank you. Thank you, Swarupa.
Thank you, Madam, for those kind words and your support always. for us. So now I request Dr. Aparna Vartak Patil, who is from 1986 batch.
Yes, Swarupa, am I audible now? Hello.
Yes, you are audible.
Uh, Respected authorities, myself, Dr. Aparna Vartak, representative from batch 1986. I'm here to express my feelings. I have completed my MBBS and MD in obstetrics and gynecology, both from this prestigious institution. I was practicing previously in Andheri West, and now I'm practicing in Virar since past 7 years. Admission to Seth GS Medical College, the elegant stone structure with British colonial architecture with grand entrance is the greatest achievement of life for all of us. The finest medical institute in the city, the state, and one of the best in India. Along with the various celebrations like welcome social by our seniors, few picnics, Rose Day, Avishkar, Orchestra, Orgy, we were introduced to lectures in huge lecture halls, many vivas, spots, dissection, and many long exhaustive exams. But our teachers, Dr. Manu Kothari, Lopa Mehta Madam, Dr. Natarajan, Dr. Mahindrakar, Joshi Madam, Kokani Sir, helped us all. Dr. Manu Kothari and Dr. Natarajan taught us to respect tissues even during dissection. Ability of Lopa Madam to write with ease with her both the hands impressed us all. We received a lot from this prestigious institute, from our dedicated and excellent teachers, from patients, lots of practical knowledge, even from Mama of casualty, minor OT, and injection OPD. It was like wealth of clinical and practical knowledge. Teachers taught us honesty, integrity, perseverance, patience, and desire to give the best. And this institute has taught us to fight against tough competition in our life. We lost few of our friends like Shilpa Nabar, kind-hearted Swati Dandekar, Poonam Satpute, Sunita, Parag, Jinesh, and friends, you all will live forever in our memories. We learned some new words like Ghasogiri, Ratta, Katta, Cutting Chai, Khufia clinics, etc. in this institution. I feel very proud to be part of this institution and to be part of this class of 1986. Each one is like a star in his or her field of work. In the end, I want to sum up my feelings in my poem. जिंदगी का सबसे फेवरेट चैप्टर पढ़ने को आज दिल चाहता है. जिंदगी का सबसे फेवरेट चैप्टर पढ़ने को आज दिल चाहता है. बस एक बार जीएस में वापस लौटने का मन करता है. कुछ खट्टी कुछ मीठी बातें याद आती हैं. ऐसे मजेदार पल जो कल के ही लगते हैं. अब की बार डिसेक्शन अटेंड करने का मन करता है. अब की बार डिसेक्शन अटेंड करने का मन करता है. दोपहर डॉक्टर गोकानी की बायोकेमिस्ट्री की क्लास में आंखें बंद करने का मन करता है. एग्जाम टाइम का वो टेंशन याद आता है. एग्जाम टाइम का टेंशन याद आता है और एग्जाम के लास्ट दिन हॉस्टल से घर वापस जाने का वो पल दिल याद करता है। लाइब्रेरी में बैठकर रट्टा, दबा खाने के लिए कट्टा, एलसीआर वो कट्टा, कटिंग चाय की यादें फिर याद आई। वो कॉलेज का पहला दिन, रोज डे, आविष्कार, वो सब दोस्त जो बिछड़े तो ये लम्हे याद आए। जीएस में किताबें नहीं, जिंदगी जीने का तरीका पढ़ा है हमने। जीएस में किताबें नहीं, जिंदगी जीने का तरीका पढ़ा है हमने। अगर जिंदगी के पन्ने पलटू तो जीएस में वापस लौटने का मन करता है। थैंक यू वेरी मच।
Thank you very much, Dr. Aparna, for those words and your memories. Thank you. Now I request I call upon my friend and matchmate, Vijaya Lakshmi Shahara. Actually, she's busy in her OPD and she's just taking out 5 minutes from her pediatric OPD. So I request her to join and express her thoughts. Vijaya?
Yeah, hi. Hi, Swarupa.
Hi.
Hi, Swarupa. Good afternoon to you all, and a very warm namaste from Vidyate Mahir Ghar, Pune. Hi all, this is Dr. Vijaya Shahara, a proud GSite and a KEMH, and I am a practicing pediatrician from Pune, and I represent the 1990 batch. I'm very overwhelmed to see everyone hearing on different thoughts, and it's really, as if I'm leaving the memories of GS, and I'm already into the, the GS atmosphere and the GS corridors and the hospital. I'm remembering all that so much. Even as all of us in our batch have most recently celebrated half a centenary of our life, I still this memories, and as I hear all of you saying the memories of all my teachers, my seniors. Okay, I can see Lopamita madam, a very dear Lopamita madam. Okay, she used to be our in the hostel, girls hostel as well. Okay, then Vasudevan madam also I can see, and yes, my dear friend Swarupa, which bring back the memories of all other friends and colleagues too. Okay, it is flowing down, it's gushing down. I'm really overwhelmed to say that. Dear all, it gives me immense pleasure to be here today, witnessing this moment of centenary celebration of a beloved institute that has shaped our lives. Actually, to say, when my dear friend Swarupa announced in our group regarding the celebrations of the centenary and making of reflections, the GSMC reminiscences, I actually stopped, really actually stopped for a while. And for me, at that moment, the countless golden memories of yesteryears came rushing like a mountain stream, flowing fast and full, carrying with it the faces, the voices, the laughter, the fear, the tears, the unknown secrets that, of course, all of us knew at the end, the MLT, the labs, the fearful vivas, and the unending biochemistry cycles and the equation. And yes, of course, our caring, kind, and the hardworking teachers were always there for us, like a family. So many of you here will agree with me that even small things like the canteen chai at the popular katta, a good afternoon sound nap in the AC library, and of course, much more also in the library, are unforgettable moments etched on our mind's canvas. Friends, teachers, and colleagues, the rewards, the achievements, and the top spots that we all carry now on our shoulders, all of it seems so very, not so very pricey in face of these timeless moments that we all have lived together. Today, as I thank the Centenary Committee for the opportunity to express myself on behalf of my 1990 batch, I would like to say, even as life has taken us on different paths from different parts of the globe, the friendship, the values that we have learned here remains constant, timeless, and of course, deeply meaningful. And as I can feel every heart here, every heart here beating with gratitude for those beautiful times that we all had together. I really reverberate the thoughts of my earlier speaker, Dr. Aparna Patil, who said that if I were to ask what to do, I would love to go back to the GS and KM campuses. And yes, with that, I would just like to say, dear friends, colleagues, mentors, wish the time stood still. Thank you very much. Thanks.
Thank you. Thank you, Vijaya, for putting your thoughts on behalf of her batch 1990. I know everyone resonates with her thoughts. Thank you. And thank you for taking out time from your busy OPD.
Thank you, Sorka. Thanks.
Now I request from 1960 batch Dr. Malini Nadkarni madam to express her.
मालिनी अनम्यूट कर.
Hello, can I be heard?
Yes.
Can I be heard?
Yes.
Yeah. So I'm very fortunate to have been born in KEM compound itself. My father was the first radiology houseman, a radiology resident of KEM when Dr. Jivraj Mehta was the dean. In 1940s, he was given a spacious quarters in KEM campus, and he was the only radiology resident on duty after the office hours. So I am born in such beautiful campus, and I was fortunate to get admission into KEM. My father, though he was a radiologist, he did not want to. Hello, am I heard?
We can't hear you.
No, we can hear ma'am well.
Hello?
Yeah. Now you can hear.
Yeah, can you hear me? Okay.
Yes.
So I was very fortunate to do radiology because my father didn't want me to do radiology. He wanted me to do gynec obstetrics. I wanted to do surgery. And there was a house post available in Department of Surgery, and it was a radiology house post with Dr. Sheila Deshmukh. The engineer Deshmukh, she was a Parsi lady. She was the head of the department then. And I was very fortunate to be with her. And I learned many invasive techniques. That time radiology was not the way it is now. There was no CT, no MR, no ultrasound also. It was just plain, simple Röntgen rays. And we used to puncture all possible sites, transluminal aortogram, transvenous, transosseous venogram, name anything, and it was available to us, because there were people who were interested and enthusiastic to do a lot of things and learn a lot of things. So we started with all these interventional radiology things, and now we are the pioneers in the field of interventional radiology in India. Of course, you heard about Dr. Ravi, and he has taken our department to the international standards. So I think I should not take much time from you. I have written a book. I would like to show if you can. I don't think I can be seen. Anyway, this book is called X-Files KEMH. It's in Marathi. I have published that book and it is appreciated by many. I had done an English version of this on Dr. S.K. Pandya, late Dr. Pandya's request, but that is not published. If it is published, I'll let you know. But thank you very much and best of luck to all GSites.
Thank you, madam.
Thank you. Thank you.
Now I request Dr. Solbhai Ranade from 1960 batch. Madam, please join and say a few words.
Good afternoon, everybody. I am Dr. Mrs. Sulabha Ranade, was admitted in KEM as Sulabha Narayan Devdar in 1960 batch. I thank you all and the organizers for inviting me in this meeting. Somehow, I prefer to speak in my mother tongue, that is Marathi, so that I can explain my thoughts in more nice way. मी डॉक्टर सुलभा रानडे, डॉक्टर सुलभा देवधर, मी 1960 साली KM मध्ये मी फर्स्ट MBBS ला ऍडमिशन घेतली. त्यावेळची ऍडमिशन सुद्धा खूप सोपी होती. आता सारख्या कॉम्पिटेटिव्ह एक्झाम्स नव्हत्या. फक्त इंटर सायन्सच्या बी ग्रुपच्या मुलांना मेडिकलला ऍडमिशन मिळत असे आणि त्यात चांगले मार्क मिळाले की ऍडमिशन मिळत असे. तशीच मला पण चांगले मार्क मिळाल्यामुळे लगेच पहिल्या दिवशीच माझी ऍडमिशन झाली. 3-4 लोकांचा बोर्ड बसला होता एक्झाम इंटरव्ह्यू घ्यायला. त्यांनी विचारलं तुम्हाला कशासाठी डॉक्टर व्हायचंय. तर मी त्यांना असं उत्तर दिलं होतं त्यावेळेला की माझे वडील अस्थमॅटिक होते. तर मी त्यांना सांगितलं की त्यांचं रोजचं दुःख मला बघवत नाही आणि मी डॉक्टर होऊन त्यांच्यासाठी काहीतरी करू शकेन असा प्रयत्न मला करायचा आहे. त्यासाठी मला डॉक्टर व्हायचंय आणि त्यामुळे मी त्या वर्षी मी ऍडमिशन घेतली आणि मला जो परमानंद मिळाला की संबंध मुंबईतील आणि ऑलमोस्ट भारतातील उत्तम कॉलेजमध्ये मला ऍडमिशन मिळाली होती आणि ती ऍडमिशन केल्यानंतर आम्ही 4.5 वर्ष त्या कॉलेजमध्ये चर्नी रोड टू एल्फिस्टन रोड असा ट्रेननी प्रवास करत होतो. त्या प्रवासाची पण एक गंमत आहे. आमच्या बरोबर आमची बरेच मित्रमंडळी बरोबर असायची आणि डॉक्टर UK शेठ आपल्या फार्माकोलॉजीचे प्रोफेसर ते पण सांताक्रूजहून ट्रेननी यायचे आणि ते आमच्या बरोबर असायचे आणि ते प्रोफेसरने आम्ही स्टुडंट असा भेदभाव कधी त्यांनी केला नाही आणि आमच्याशी सुद्धा ओळख दाखवून गप्पा मारत असे आम्ही KM पर्यंत प्रवास करायचो. त्यानंतर फर्स्ट MBBS ला आपल्याला एक्सपेरिमेंटल फिजिओलॉजी आणि सेकंड MBBS ला एक्सपेरिमेंटल फार्माकोलॉजी मध्ये आपल्याला लाईव्ह ॲनिमलची प्रॅक्टिकल्स आम्हाला करायला लागायची, जी आताच्या स्टुडंट्सना करावी लागत नाहीत आणि करायला मिळत नाहीत. पण आम्ही ओपन हार्ट सर्जरी त्यावेळेला रॅबिटच्या हार्ट वरती ॲड्रिनलिन देऊन त्यांचं कसं ऍक्शन्स कशा होतात त्या सगळ्या आम्ही त्यावेळेला लॅबोरेटरीमध्ये बघितल्या होत्या. फर्स्ट MBBS मध्ये अनेक कार्ड एक्झाम नाही पार्ट एक्झाम एवढ्या असायच्या की त्या एक्झाम मध्येच आपलं 7 वर्ष कसं निघून जायचं ते कळत नसे आणि बाकी काहीही करायला त्यावेळेला वेळ मिळत नसे. फार्माकोलॉजी मध्ये सुद्धा सगळी औषधं स्वतः बनवायला लागायची. मिक्सर्स, पावडर्स आणि लिनिमेंट्स सगळं सॅच्युरेशन स्वतः करून असं एक्सपेरिमेंट म्हणजे खरोखरच एक्सपेरिमेंटल फार्माकोलॉजी तेव्हा होती आणि त्या अशा तऱ्हेने आम्ही तेव्हा काम केलं. नंतर कॉलेजच्या हॉस्पिटलच्या साईडला गेल्यावर बेडसाईड क्लिनिक्स ही फार महत्वाची असायची. आम्हाला डॉक्टर JK मेहता, डॉक्टर गोलवाला, डॉक्टर JM मेहता सगळ्यांनी इतकी सुंदर क्लिनिक्स घेतली की त्यांनी सांगितलेले शब्द अजूनही आमच्या कानात चांगल्या रीतीने घुमतात. डिफरन्शियल डायग्नोसिस करताना सुद्धा आपण कसं डायग्नोसिस करायचं, काय करायचं याचा विचार ते खूप चांगल्या रीतीने करत असत आणि ज्या स्टुडंटची ती केस असायची त्याला त्याच विषयाचा पूर्ण स्टडी करून जायला लागायचं कारण ते मध्ये प्रश्नोत्तर होत असत. त्यामुळे आपोआपच अभ्यास होत असे केसेसचा. डॉक्टर गोलवालांची कमाल होती. डॉक्टर गोलवालांनी काही कार्डियक मर्मर्स होत्या त्या रेकॉर्ड केलेल्या होत्या गॅलप रिदम सारख्या आणि त्या ते स्टुडंट्सना क्लिनिकच्या वेळेला ऐकवायच्या. इतका मेहनत घेणारे प्रोफेसर्स आणि टीचर्स असल्यानंतर अभ्यास हा चांगला आलाच पाहिजे आणि स्टुडंट चांगले तयार झालेच पाहिजेत असं माझं मत आहे. ओपन हार्ट सर्जरी तेव्हा फक्त डॉक्टर PK सेन आणि परुळेकर आपल्या कॉलेजमध्ये करत होते आणि त्यांच्या त्या सर्जरीज आम्ही वरून काच असलेल्या बंद याच्यातून आम्ही ते बघत होतो आणि तेव्हा मला खूप आश्चर्य वाटायचं की हे ओपन हार्ट सर्जरी नवीन होती त्यावेळेला आणि त्यावेळेला आम्ही नवीन तेव्हा ती बघितली गेली. KM हॉस्पिटल एवढं प्रचंड मोठं, त्याचं GS मेडिकल कॉलेजची ती प्रचंड रचना, एवढे मोठे कॉरिडॉर्स हे तर इतके इम्प्रेस करायचे की आम्ही कुठेतरी एका मोठ्या इन्स्टिट्यूट मध्ये शिकतोय आणि काम करतोय याचा आनंद सदैव आमच्या मनामध्ये असायचा की आपण एक चांगल्या ठिकाणी आपण काम करतोय. केएम मधल्या प्रचंड गर्दीमुळे पेशंटचा एक्सपिरियन्स जो होता तो खूपच मिळाला. त्यावेळेला ट्युबरक्युलोसिसचे पेशंट पण खूप असायचे, त्यामुळे इंजेक्शन डिपार्टमेंटला सारखी लाईनच्या लाईन लागलेली असायची टीबीच्या पेशंटची. म्हणजे काय त्यावेळेला होतं हे आत्ताच्या पेक्षा निराळं, ते तुम्हाला मी थोडंसं सांगू इच्छिते. त्यावेळेला अँटीरेबिक वॅक्सिन त्याचे 14 डोसेस द्यायला लागायचे आणि ते पोटावरती इंट्रा सबक्युटेनस देताना त्यांचे एवढे फुगे तितके पेनफुल व्हायचे की देताना आम्हाला सुद्धा पेन वाटायचे की पेशंटना रोज रोज आपण अशी इंजेक्शन देतोय आणि ही खूप छान छान नाहीये, पण त्याला इलाजच नव्हता, दुसरं काही सोयच नव्हती. कॅन्टीन त्या मनाने तेव्हा खूप बेताचं होतं, पण कधी आपला डबा नसलाच तर आपल्याला खायला वेळ असण्यापुरती तिथे सोय होती, पण खूप मोठं कॅन्टीन आणि व्हरायटीज तिथे नसायच्या त्यावेळेला. मात्र खेळाची सुद्धा खेळणाऱ्या लोकांना बॅडमिंटनची कोर्ट चांगलं होतं, टेबल टेनिसचं कोर्ट होतं आणि दरवर्षी आमचा हॉस्पिटलचा कॉलेज डे जो व्हायचा ना तो मात्र रात्रभर धुमाकूळ असायचा. खूप छान छान गाणी आणि खूप छान छान नाटकाची मुलं खूप बसवत होती आणि खूप एन्जॉयमेंट त्यावेळेला असायची. तो कॉलेज डेची आम्ही वाट बघत असायचो दरवर्षी आणि तो पहाटे पण रात्री सुरुवात झाली की पहाटेपर्यंत चालायचा. त्यामुळे खूप चांगलं असं वातावरण त्यावेळेला बघायला मिळायचं. आपली लायब्ररी त्या मनाने तशी लहानच होती, पण तरी सुद्धा विद्यार्थ्यांना त्यावेळच्या विद्यार्थ्यांना आम्ही 100 लोक त्यावेळेला एका वेळेला ऍडमिट होत होतो. आमचा 100 जणांचा बॅच होता. माझ्या बॅच मध्ये डॉक्टर अशोक अंबर्डेकर, डॉक्टर आशुतोष पुसाळकर, आता ही मालिनी नेरुरकर आणि आता नाडकर्णी, वंदना मर्चंट आणि वाळवेकर, त्यानंतर हेमा चांदोरकर पिशपती, तशीच चंद्रात्रेय आणि ती नंतर राव झाली. अशा सगळ्या चांगल्या चांगल्या आणि सिनियर लोकांच्या बरोबर मी ते नंतर खूप चांगले ऍडव्हान्स शिकले पुढे. त्या लोकांच्या बरोबर मी आमची खूप घसण असायची आणि आमच्या त्या मैत्रिणी होत्या आणि त्यामुळे मला खूप जो काही त्यावेळेचा जो आनंद मिळाला त्याचा मला आयुष्यभर उपयोग होतोय. तिथे जे आम्ही शिकलो ते पहिला पेशंट माझ्या स्वतःच्या प्रायव्हेट मध्ये म्हणून बघताना मला खूप कॉन्फिडन्स होता की मी बघताना व्यवस्थित पेशंट बघू शकेन, की त्यांना योग्य औषध पाणी देऊ शकेन. मी पहिली 1965च्या डिसेंबर पासून 1981च्या मे महिन्यापर्यंत मी मेडिकल ऑफिसर इन्चार्ज डिस्पेन्सरीज म्हणून म्युन्सिपल डिस्पेन्सरीज मध्ये 15.5 वर्ष काम केलं आणि त्यानंतर जून 1981 पासून मी माझा स्वतःचा दवाखाना गोरेगाव येथे चालू केला आणि त्यानंतर आता कोविड येईपर्यंत मी दवाखान्यात काम करत होते. कोविड नंतर मात्र स्वतःला आता ह्या कोविडच्या पेशंटचे एक्सपोज होऊ देणं बरोबर आहे का? ॲट द एज ऑफ 80 सगळ्या घरच्या लोकांनी पण प्रिव्हेंट केल्यामुळे मी त्यानंतर दवाखाना बंद केला. पण घरी मात्र अजून थोडी जी पेशंटची सल्ले असतात ते द्यावेच लागतात. जुने पेशंट काही आपल्याला सोडत नाहीत तसं. त्यामुळे अशा तऱ्हेने माझा केएम मधून जी काही मी शिकले ते मला आयुष्यभर माझ्या प्रॅक्टिससाठी उपयोग पडलं आणि मी केएमने मला ब्युटिफुल मेमरीज दिलेल्या आहेत. त्या किती सांगितलं तरी पूर्ण नाही तेवढ्या आहेत. तर आता मी एवढं महत्वाची, माझे मिस्टर सुद्धा केईएम मधूनच त्यांनी पीएचडी केलेली आहे फार्माकोलॉजी मध्ये. नमस्कार. आणि त्यांनी डॉक्टर युके शेटच्या डिपार्टमेंट मध्ये डॉक्टर करंदीकरांकडे ते शिकलेत आणि ते पण अल्युमिना आहेत आपल्या केईएमचे. त्यामुळे मी त्यांचीही माझ्या याला दुजोरा मिळाला. आता मी थँक्यू ऑल फॉर गिव्हिंग मी सच अ नाईस ऑपॉर्च्युनिटी. थँक्यू.
खूप खूप धन्यवाद मॅडम. खूप छान सांगितलं तुम्ही तुमच्या सगळ्या आठवणी केईएम बद्दलच्या आणि थँक्यू फॉर जॉईनिंग. आता यानंतर मी डॉक्टर फाल्गुनी शाह ऑक्युपेशनल थेरपी 1973 बॅच रिक्वेस्ट हर टू टॉक अबाउट हर मेमरीज. Dr. Falguni Shah, madam? Yeah.
Am I audible?
Yeah, we
Yes,
can hear
yes,
you.
yes.
Yeah, we can
I'm
hear.
audible? Okay. Uh, it's a really nostalgic moment for me to be here now. I feel as if I'm in KM campus, witnessing so many new, things and taking back me to the down the memory lane with all those professors, all those teachers, and I really thank Dr. Swarupa for giving me this opportunity to and encouraging me to write certain things in the reflections. And and I am really very thankful to Dr. Lopa Mehta for encouraging me to write this, because I think after she heard me on the video reunion, and she encouraged me that you have to write something of your experiences. So I wrote down my golden memories on in reflections. Uh, and I'm still a very active and sports person. I go swimming daily. I play carom, I play table tennis, and that keeps me fit and fine. And that was one of the reasons my sports activities have put me on the KEM and GS medical list. Because of that, I got admission into KEM. As my I had lots of certificates from my school, my colleges, and that time they were giving marks for each sport you played. So I got about 25 marks on the very first day, and my name rose up to the merit list, and I was the 32nd student to be admitted to the college. And I'm very much grateful to KM and GS Medical College for giving me this opportunity, and then later on allowing me to play intermedical badminton in sports. And I have certain photographs of mine in the reflections also, so which you can go through later on. And so my this passion for sports and these activities have kept me still very fit and fine and strong. Thank you very much.
Thank you very much, madam, for joining us and for contributing your article and expressing your thoughts. Now I request Dr. Lakshmi Vasudevan, madam, 1967 batch, to express her thoughts.
என்னோட இது என்னோட ஃபேஸ் எப்படி தெரியாது எப்படி வரும் I've come okay. I'm okay. Hello, good afternoon to everybody. Dear Swarupa and Dr. Lopa Mehta and advisors of the Medical Humanities of Seth GS Medical College and KEM Hospital. At the outset, let me thank you on behalf of self and our GSMC entry batch 1967 for inviting us for the book release of Reminiscence Part 1 by the Department of Medical Humanities of GSMC. GSMC Alumni Association. We consider this as a honor and privilege to be part and we have put the countless memories of these twin institutions in words, which you have put in print form to be preserved for posterity and probably eternity. It has been a joint effort. I'm Lakshmi Vasudevan, an alumnus and an ex-faculty of this institution. I took voluntary retirement in June 2001 After having served as a lecturer and associate professor in the Department of Anatomy, following my MBBS, after MBBS, I did my DCH at Jarbavadia Hospital under Dr. S.M. Merchant. Thereafter, I did my MD Pediatrics under Dr. M.K. Jain and Dr. M.D. Shah at KEMH Hospital. Then I joined as lecturer in anatomy and did my MS Anatomy and taught in the department for a period of 20 years till my voluntary retirement in 2001. Thereafter, I took a fellowship in human genetics at Duke University Medical Sciences, Durham, USA in 2002. When I returned, I joined the Genetic Research Center of ICMR Parel as a clinical genetic consultant. After a few years, I retired and joined practice with Dr. Parag Tamankar's genetic clinic as Ecstasy Mall, Mulund, where I still continue. In these long years, I made many friends from our fraternity, our teachers, my classmates, my seniors, my juniors, and most of my friends very close to me are from my batch, with whom I still keep in contact through a WhatsApp group. Most of them have contributed to reminiscences, so I am not repeating them. Of all my batchmates, specific mention should be made of my long association with my batchmate, Dr. Almelu Shankar. We have a very long association from our school days. We studied in the same school, same college, and joined St. G.S. Medical College at the same time. We were quite opposite in our behavior. I'm talkative, short-tempered, and restless, whereas she is reserved, soft-mannered, and quiet. I picked a leaf from her as how to control my temper, how to talk less, and just by watching her. I would like to state here that she molded my character, and I'm ever thankful to her. I was not like this earlier. She has now settled in Calgary, Canada. She's an anesthetist from KEMH Hospital. I keep in touch with her in June 2017 to celebrate our Silver Jubilee year of admission to KEM. Myself, along with my batchmates, Vidya Kulkarni, who is a pediatrician in Mumbai, and Dr. Radha Bhatt, child and adolescent psychiatrist in practice in UK, visited her and her family in Calgary, Canada, and had a memorable get-together reflecting our golden memories of GSMC and KEM Hospital. Now I made this a short because I want to talk to you about a friend, Dr. Shantu Patel, who has given a very good write-up. Just give me 1 minute, 30 seconds, I'll come back to you. This is from my dear friend, our batchmate, Dr. Shantu Patel, who is a geriatrician in USA. She has contributed to a reminiscence too. Now, she wanted to be present, but I think it's night time for her, so she requested me to read it. 5 years, she was here till MBBS. 5 years seems such a minuscule duration in my life of 77 years, but years of wisdom gathered as a result of failures and trials, tribulations, has taught me over and over again that the duration is only a measure of time, and it's how you utilize that time, be it learning of a new skill, digesting and reflecting on learned information, or assimilating the fundamentals of years of learning into relevant, pertinent, and practical application. We were extremely fortunate to have had professors and practicing physicians and surgeons who seemed to instinctively know and how to mold our brains, our young brains for precise and practical learning. It is indeed an art to be able to teach and impart such knowledge and wisdom to a group of 160 or so students who at best have brief attention spans and seem more occupied with each other competing for age-appropriate interests. He has given little in Hindi. तारीफ क्या करूं इस महान विद्यालय की जिसने हमें न सिर्फ जो सिखाना था वो सिखाया बल्कि एक काबिल चिकित्सक डॉक्टर बनाया और यह भी सिर्फ 5 सालों में. Yes, the foundational principles of medicine were laid in those 5 years, and in retrospect, I can only say with a lot of pride that it was the most challenging part of my formative education that gave me a scope to grow on those basic courses on anatomy, physiology, pharmacology, etc. Medicine is one field where ongoing education and skill development is a must, and this has to continue throughout our careers, or simply cannot afford to be lackadaisical or of a procrastinating nature. To this day, I still marvel at the amount of information I learned about our human body, and perhaps so much that I missed out on, as I was not astute enough to learn subjects that seemed boring and at times utterly useless information. Professors, teachers, clinicians diligently imparted knowledge we needed, but I recall that often a bright nursing staff member had come to my rescue in pointing and redirecting my line of thinking and holding my hand as I learned to do my first IV blood draw or the first lumbar puncture. A pair of steady hands over my own shaky one smoothly guided that first helping. We, as alumni of this very prestigious medical teaching institute, must carry a very poignant message for future students graduating from this elite institution that the burden of providing the best optimal health care is not only our duty, but an earned prerogative which we must render with our expertise and compassion. Would we, physicians, are indeed privileged to serve humanity like no other profession that comes to my mind. Pioneers of this great teaching institution, and it is your combined efforts and generous philanthropic contribution of a family that found this truly great medical school, which we alumni proudly came to be our kshetra or field where we sow the seeds of knowledge to become young, independent healthcare providers. Thank you very much.
Thank you very much, madam, for such wonderful thoughts put up by Dr. Shanti and yourself also. And now I request Dr. Abhijit Pednekar from 1992 batch to talk on the behalf of his batch.
Yeah, thank you, Dr. Swarupa. I'm Dr. Abhijit Pednekar. I'm from the 1992 batch. And I think I would like to thank the organizers for giving this opportunity. It's really overwhelming and feeling of pride to see all of you sharing your stories. And I think it takes me back to the days of 1992. So I think, like everybody else, for me also, the GS Medical College admission was a dream come true. Initially, in the first list, I was in the JJ list, and then by stroke of luck, I think I got this admission in GSMC, and I think then it has only given me, many things. My best friends in life, some of the best teachers who have molded and shaped me. I mean, everybody has talked about all of them, but I think a few names which come to mind is Dr. M.L.K., Dr. Lopa Mehta, Dr. Bhuyan in the first year, Dr. S.K., and Dr. R.D.B. and so many other doctors who shaped our futures at that point of time. I also developed multiple friendships with multiple people. Like everybody else has mentioned earlier, we are still in touch thanks to technology, thanks to WhatsApp. And we do have these mini reunions which happen almost every once in 3 months, which kind of helps us navigate this life in a much better manner. We help each other out, and like somebody mentioned earlier, I think in your college days, you probably know 20 people really well, and you're friends with 5 to 6 in a very close manner. But I think as you, because of WhatsApp, and now as you meet each other in reunions, we've also, kind of matured emotionally, and we've come closer. And so we stay in touch with a larger chunk of people. So I think that is something which we really enjoy. From a, I think, life perspective, there are a lot of learnings which I keep on talking to my juniors and to my teams now, because now I have not gone into clinical practice. I've done my MD in preventive and social medicine, but later after working with WHO for a while, I chose to move into the pharmaceutical industry, and I'm heading the medical affairs team for USV. It's a pharmaceutical organization. And I think that is where all these learnings really come to life. And I think I've written that in my article, to constantly stay curious, inquisitive, to constantly look after excellence, not look at mediocrity, to constantly look at how we can get better. I think these are certain qualities which get imbibed in you, to have a value system in place. And the most important thing is, GS being the top school, medical school, generally you find the best of the minds coming into that space. And that happened for me as well. I was somewhere in the middle. The top 30, 40 people got a lot of attention from most professors and teachers. The bottom 30 also got a lot of attention. I was right in the middle. And what happens to the person in the middle is sometimes they can lose their identity. And I think for me, luckily, I was able to find that back, work on my other skills. And now what I read from various literature and research is that typically, cognitive skills will only define 20% of your success, but rest of the success is taken care of by the character skills like discipline, dedication, determination, and so on. And I think that is where I credit GS, my teachers, friends, and everything that GS taught us as an institution to help us navigate this life in a much better manner, be future role models for younger generations, and also even an average student like me, I did not score any distinction in my all 3 years in GS, but I think today I'm able to create a lot of youngsters who will get great amount of success in their corporate life. And I think that's the beauty of it, that ability to coach people, ability to pass on values, ability to pass on knowledge. I think that is something which GS has been responsible and imbibe those value systems and inculcate those values in me. So I thank the institution for that. Whenever anybody comes to Mumbai, I continue to be in Mumbai. But anywhere where my batchmates come to Mumbai, we do make it a point to revisit GS Medical College whenever we have time, and revisit the canteen, the katta, the library, and it brings us a lot of nostalgia and brings a lot of good memories to us. So I think let's hope and pray, and I wish that GS continues to be this beacon of light for a lot of young generations and continues to inspire many young people and creates more leaders. So thank you so much for the time and for the opportunity to speak. And over to you, Dr. Swarupa. Thanks for the
Thank
great
you, Abhijit.
celebration.
Thank you for nicely putting down your thoughts, expressing your thoughts. And we can meet next time when you come to KEM, and we will definitely catch up to
Absolutely.
Yeah, as you said. Okay. So now, last but not the least, 2005 batch is the youngest alumni who have contributed in this volume of reflections. Dr. Sarika Dakre, I request her to say a few words on behalf of 2005 batch. Sarika.
Good afternoon, everyone. I would like to first start with paying the homage to all my respected teachers, doctors, and all the seniors who are present here today. Myself, Dr. Sarika Dakre, I am the alumni of 2005 MBBS batch. Then I pursued MD in anatomy at the same institute. said GS Medical College, and I feel myself fortunate to still working at my alma mater as an assistant professor in the Department of Anatomy at St. GS Medical College. First, I'm sincerely grateful to the Department of Humanity for organizing the virtual reunions and also giving us to just pen down our memories about the GS. This speaking about gist of my writer, which I gave about my experiences. When first time we came about this, my friend Dr. Vivek Shah, my UG batchmate, and I began planning of the virtual reunion, and we were flooded with the memories of college, nostalgic moments with the friends. It also reminds us about the very small kissas on the kattas, clinical postings, excitement about the sports, Avishkar, Gosumec, and all these discussions only gave us a different kind of happiness. Then we decided that rather than simply sending the message, WhatsApp group messages, may not be enough to reignite the connection. So we began calling our batchmates personally, and those phone calls gave us a glimpse into each other's lives. We shared our stories again, and we reconnected again through those phone calls. Then we finally met on the 9th December 2024 virtually, and everyone was so excited after seeing each other after a long time. We cherish lots of memories and then felt that and even ours wouldn't be enough for this. Then few days later, Dr. Sarupa ma'am asked to pen down our experiences about the GS. And again, I confused where to begin. Then we decided to write up. Then our journey at the GS actually filled with the countless moments. But we decided to start with the Mumbai floods of 2005, which was just 1 week after our admissions. So our the admissions are also get postponed at that time. Got postponed at that time. Then after that, we wrote about the transitions to the city life, then challenges of adapting to the hostel life, the vast syllabus. We also reflected on the lifelong friendships which we formed at the GS, then the smell of formalin at the dissection hall. Being an anatomist and still experiences those things. And whenever new batch comes and I enter into the dissection hall, I always remember the first table and my dissection partners, Dr. Renuka and Dr. Rajwardhan. Also, we mentioned in this write-up about the involvement in the activities like Disha, compiling of the Disha magazine in the first year, then Avishkar Apurvai in the second year, publishing Gosumec 2008, then participating in the GSPL matches, treks, AIM strips, and so on. We fondly recall also the memories in the LCR, that is the ladies' common room, BCR, common room, and the kattas in front of the canteen. Beyond fun, we highlighted the immense learning we gained through the clinical posting, PSM visits, and opportunity to be taught by the true stalwarts of various disciplines. The list of names is too big, so I'm not mentioning anyone's names personally. We also learn from our patients, teachers, peers, nurses, mamas, and also the spirit of the institute itself. Most importantly, at our time at the GS taught us the values that remain with us forever, and which includes mainly the dedication, hard work, and the professional ethics. Also, at the last, we bowed down with a gratitude to all those people who helped us to shape our journey, which includes again the same teachers, our mentors, peers, and so on. At the end, I concluded both my write-up as well as my speech today with a line that every GSI knows by heart. Chak chaka chak chakmak chakmak. Who are we, GSIs? Thank you so much for listening me patiently. Now I will hand over to Dr. Sarupa.
Thank you, Sarika. Thank you very much for your article and your speech and joining us here today. Now I request Dr. Ravi Ramakant sir to say a few words.
Let's start by thinking, how come we are here today? how is it that maybe ours is the only college that has a program like this, something called Reflections, and that is because of the Medical Humanities department. How come ours is one of the very few colleges, maybe a handful of colleges in the country that has a Medical Humanities department? It came about because of our teachers. Every college will teach you anatomy, physiology, how to dissect, how to operate, how to give drugs. There are very few, extremely few, where teachers will teach you how to think beyond medicine. That, I think, is the greatest pride of our college. Not only during my medical school days, but even post that, especially post that. I joined in 1971 as a medical student. I retired in 2010, 40 years every single day in the KEM campus. I was so popular that when I retired at 2010 at the age of 58, 1 year later, the BMC increased the retirement age to 62. They liked me a lot and they waited for me to get out anyway. So it's all about our teachers, and I don't want to name names, but they, at least as far as I'm concerned, made me think beyond medicine about spirituality, about who we are and where we come from, what is life, what is death, and who was Sir William Osler. Things like that. That is what will stand us in good stead now. And if you read the goings on in AI will replace doctors, but AI will not replace nurses because nurses are human caregivers. But our college, with background like this, with a department like Medical Humanities, will go forth and teach our students what it is to be not just a doctor, but a caregiver. That is what I'm really proud of. Besides many other things that are there, so I said I will not repeat those things. And those students who might be listening to my talk, be grateful that we are different from other colleges in not just teaching the subject, but teaching beyond the subject, in making us think as human beings, relating to other human beings who are not fortunate enough to be well all the time. And I hope with people like no names, people like those who are in charge of medical humanities today will take this forward and the department will flourish and we will create more people who are caring about the patient, not just curing. Thank you.
Thank you, sir. Thank you very much. Now, I request Dr. Padmaja Samman to propose the vote of thanks. So, very good afternoon, everybody. Good morning, good evening, wherever people are. It has been an overwhelming experience, to say the least, to hear people from all different batches, their emotions and their memories for this and of this institute. It was particularly, as Ravi sir said, and in these times of where the medical students find themselves in a very tough emotional times, you must have been reading it in the newspapers, etc., everywhere, that there is a lot of skepticism and some negativity, lot of competition, lot of tough times students are going through. And if they saw this type of emotional bond with their institute that you all have manifested, it will really increase and sort of reinforce their faith in their institute's fabric and work culture and educational culture. I really wish all students see this recording. Coming back to my job,
this is because of Lopa Madam's idea that all the various batches come together and they have a platform to meet up, and it couldn't have been possible without the 24/7 work that Dr. Natarajan sir has put up, because otherwise this wouldn't have been possible, getting contacts of so many people, personally looking after the organization by the students, and of course the students who have besides their study hours, they have put in time to organize this. They have executed the program. So I'm extremely thankful to Lopa Madam, Natarajan sir, and the students. My heartfelt thanks to the Dean, who has always supported our activities. Without her support, this wouldn't have been possible. Dr. Supe sir, who is our Chair of Medical Humanities, Ravi sir, with his staunch support and belief in us. Dr. Swarupa, she has spent endless hours contacting people, compiling all this. She has done it with wonderful job, with all the editions of Reflections till now. Really hats off to her and the team of students. And the RRCH team here, Badal and Tushar, who have helped us with technical support, and they have also extended their technical support for each of these meetings that took place over 1.5 years. So thanks to them, thanks to Dr. Geeta Nataraj for organizing this RRCH work. And so thank you all very much. And sometime we'll meet again and chat again, I hope. So thank you all very much. Have a good day.
Thank you.
Thank you, everyone. Thank you.
Thank you. Thank you. Bye.
Bye-bye.